13 deaths in a day, an apocalyptic coronavirus surge at a New York City hospital. Hospitals in the city are facing the kind of harrowing increases in chances in cases that overwhelmed healthcare systems in China and Italy. By Michael Rothfield, Somani Seguta, Joseph Goldstein, and Brian M. Rosenthal. March 25, 2020. In several hours on Tuesday, Dr. Ashley Bray performed chest compressions at Elmhurst Hospital Center on a woman in her 80s, a man in his 60s, and a 38-year-old who reminded the doctor of her fiancé. All had tested positive for coronavirus and had gone into cardiac arrest. All eventually died. Elmhurst, a 545-bed public hospital in Queens, had begun transferring patients not suffering from coronavirus to other hospitals as it moves forward, becoming dedicated entirely to the outbreak. Doctors and nurses have struggled to make do with a few dozen ventilators. Calls over a loudspeaker of, quote, Team 100, Team 700, end quote, the code for when a patient is on the verge of death, come several times a shift. Some have died inside the emergency room while waiting for a bed. A refrigerated truck has been stationed outside to hold the bodies of the dead. Over the last 24 hours, New York City's public hospital system said, in a statement, 13 people at Elmhurst had died. It's apocalyptic, said Dr. Bray, 27, a general medicine resident at the hospital. Across the city, which has come from the epicenter of coronavirus outbreak in the United States, hospitals are beginning to confront the kind of harrowing surge in cases that had overwhelmed healthcare systems in China, Italy, and other countries. On Wednesday evening, New York City reported 20,011 confirmed cases and 280 deaths. More than 3,922 coronavirus patients have been hospitalized in the city. Governor Andrew Cuomo on Wednesday offered a glimmer of hope that social distancing measures were starting to slow the growth in hospitalizations statewide. This week, the state's hospitalizations estimations were down markedly, from doubling of cases every 2 days to every 4 days. It is, quote, almost too good to be true, end quote, Mr. Cuomo said. By the way, Mr. Cuomo has had been decreasing the number of beds in hospitals, and now there's this sort of mess, and now he's calling out for hospital beds. Still, hospitals are under siege. New York City hospitals run the gamut from prestigious teaching institutions catering to the elite to public hospitals providing care for some of the poorest communities in the nation. Regardless of whom they serve, few have been spared the impact of the pandemic. A flood of sick and fearful New Yorkers has besieged emergency rooms across the city. Working with state and federal health officials, hospitals have repeatedly expanded the portions of their buildings equipped to handle patients who had stayed home until worsening fevers and difficulty breathing forced them into emergency rooms. Elmhurst, among the hardest hit hospitals in the city, is a prime example of the hardships medical centers and their staffs are facing across the country. Elmhurst is at the center of this crisis. It's the number one priority of our public hospital system right now. The city's public hospital system statement said, quote, the frontline staff are going above and beyond in a crisis, and we continue surging supplies and personnel to this critical facility to keep pace with the crisis, end quote. Dr. Michael Katz, the head of the Health and Hospitals Corporation, which operates New York City's public hospitals, said plans were underway to transform many areas of the Elmhurst Hospital into intensive care units for extremely sick patients. But New York's hospitals may be about to lose their leeway for creativity in finding spaces. All of the more than 1,800 intensive care beds in the city are expected to be full by Friday, according to the Federal Emergency Management Agency briefing obtained by the New York Times. Patients could stay for weeks, limiting space for newly sickened people. Mr. Cuomo said on Wednesday that he had not seen the briefing. He said he hoped that officials could quickly add units by dipping into a growing supply of ventilators, the machines that some coronavirus patients need to breathe. Look at the lines there, seriously. It's just disgusting. The federal government is sending a 1,000-bed hospital ship to New York, although it is not scheduled to arrive until mid-April. See, that's mid-April, so that's sort of too far away. At the rate the cases are climbing. Officials have begun erecting 4 250-bed hospitals at Jacob K. Javits Convention Center in Midtown Manhattan, which could be ready in a week. President Trump said on Wednesday on Twitter that construction was ahead of schedule, but that could not be independently confirmed. That's for sure, because Trump just makes up lies, unfortunately, at the podium. He just says whatever he thinks will help the stock markets keep confidence, really. There's very little truth in a lot of what he says. Officials have also discussed converting hotels and arenas into temporary medical centers. At least 2 city hospitals have filled up their morgues, and city officials anticipate the rest would reach capacity by the end of this week, according to the briefing. The state requested 85 refrigerated trailers from FEMA for mortuary services along with staff, the briefing said. The spokesperson for the city's office of the chief medical examiner said the briefing was inaccurate. Quote, "We have significant more capacity in our 5 citywide states and the ability to expand," end quote, she said. How comforting. In interviews, doctors and nurses at hospitals across the city gave accounts of how they were being stretched. Workers at several hospitals, including the Jacob E. Medical Center in the Bronx, said employees such as obstetrician, gynecologists, and radiologists have been called to work in emergency wards. In a branch of the Montefiore Medical Center, also in the Bronx, there have been 1 or 2 coronavirus-related deaths a day, or more, said Judy Sheridan Gonzalez, a nurse. There are not always enough gurneys, so some patients sit in chairs. One patient on Sunday had been without a bed for 36 hours, she said. At the Mount Sinai Health System, some hospital workers in Manhattan have posted photos on social media showing nurses using trash bags as protective gear. A system spokesperson, that's one thing you won't see in China, is health professionals wearing trash bags. This is just a complete failure of capitalism, really. A system spokesperson said she was not aware of that happening. I've seen photos of it. And noted that nurses had other gear below the bags. Quote, "The safety of our staff and patients has never been of greater importance, and we are taking every precaution possible to protect everyone," end quote, she said. With ventilators in short supply, New York Presbyterian Hospital, one of the city's largest systems, has begun using one machine to help multiple patients at a time, a virtually unheard of move, a spokesperson said. And these poor people, and if they're sick and they have to stand in line like that, particularly if they're old people. Elmhurst Hospital Center opened in 1832 and moved to its current Queens location in 1957, making it one of the oldest hospitals in the city, New York City. In the neighborhoods it served, Elmhurst, more than 2/3 of residents were born outside of the United States, the highest such rate in the city. It is a safety net hospital serving mainly low-income patients, including many who lack primary care doctors. Queens accounts for 32% of New York City's confirmed coronavirus cases, more than any other borough, and far more than its share of the city's population. It also has fewer hospitals. Elmhurst is one of the 3 major hospitals serving a large population and is centrally located, which in part explains why it is busy in normal times, and even busier now. Medical doctors said they saw the first signs of the virus in early March, and an increase in patients coming in with the flu-like symptoms before the alarm had been fully raised in the city and the country. Test results were taking longer than then, but they eventually confirmed that many of these patients had coronavirus. In the weeks after the emergency room began filling up with more than 200 people at times, every chair in the waiting room was usually taken. Patients came in faster than the hospital could add beds. Earlier this week, 60 coronavirus patients had been admitted, but were still in the emergency room. One man waited almost 60 hours for a bed last week, a doctor said. The patients coming in now are sicker than before because they were advised to try to recover at home, doctors said. Yeah, that's always bothered me when they say, if you're sick, stay at home. I mean, if you've actually got this, and particularly if you have different other underlying illnesses, I don't think that's great advice, staying at home. It bothers me when they say that. Like in other hospitals, Elmhurst has come perilously close to running out of ventilators several times. Other hospitals have replenished its supply. Despite the more optimistic projections by the state about hospitalization rates, the crowds outside of Elmhurst have not thinned out. The line of people waiting outside of Elmhurst to be tested for the coronavirus forms as early as 6 a.m. and some stay there till 5 p.m. Many are told to go home without being tested. Julio Jimenez, 35, spent 6 hours in the emergency room on Sunday night after running a fever while at work in New Jersey warehouse. He returned on Monday morning to stand in the testing line in the pouring rain. On Tuesday, still coughing, eyes puffy, he stood in line for nearly 7 hours and again went home untested. See, that's just appalling. Quote, I don't know if I have the virus, end quote. Mr. Jimenez said, quote, it's so hard. It's not just me. It's for many people. It's crazy, end quote. Ricky Lane, a doctor who has worked at Elmhurst for more than 20 years, said the hospital had handled, quote, the first wave of this tsunami, end quote. She compared the scene in the emergency department with an overcrowded parking garage where physicians must move patients in and out of spots to access other patients blocked by stretchers. Family members are not permitted inside, she said. Dr. Lane recalled recently treating a man in his 30s whose breathing deteriorated quickly and had to be put on a ventilator. Quote, he was in distress and panicked. I could see the terror in his eyes, end quote, she said. He was alone. Other doctors said they had tried to resuscitate people while drenched in sweat under their protective gear, face masks fogging up. Some patients had been found dead in their rooms while doctors were busy helping others, they said. See, this almost sounds like a sort of a warlike situation that one sees in movies, unless you have the unfortunate experience of actually being there. And this is completely outrageous in a sovereign economy where the government can afford to cover Medicare for all. In a Yale study just recently, and Bernie Sanders has talked about this, the Yale study came to the conclusion that the government can save $450 billion with a B, every year with Medicare for all, and it saves the lives on top of the ACA. It saves more lives, 70,000 extra lives every year. And in the case of this coronavirus, I'm sure it possibly would have saved millions if people could have access to free healthcare, and that includes poor people who can't afford the treatment if they are tested positive for coronavirus. So that's the facts, and the government is owned by corporations. Both parties, the major parties, are owned by corporations, and they do everything they can to resist bringing in Medicare for all and other social programs for the public. That's because they're corporate owned. Sometimes doctors try to call patients' families when it is clear they will not recover. That is what Dr. Bray said she tried to do before the man who reminded her of her fiancé died on Tuesday. As it turned out, his mother, also stricken with the coronavirus, was a patient in another hospital. Quote, we weren't able to get in touch with anybody, Dr. Bray said. That's just awful, and I'm sure now this was written a few days ago, March 25th, 2020, and it's probably much worse now than it was then. And this is why, one of the reasons, this is why the request by health authorities to stay at home and to practice social distancing, but basically to stay at home, is one of the most important things, is the most important thing one can do to flatten the curve and stop the hospital systems from being overwhelmed. We all need to do this because this is an Italy-level situation for New York City, and as you can see, if you follow WHO and the statistics, which are probably a gross underestimation, it seems like the United States is going up at a rate of 10,000 cases a day, and that's going to escalate. It goes up exponentially, and that's an underestimation. Some say you should multiply it by 10 or even 30. That could be the case. I'm not sure how they do this really, because hardly anybody's being tested. I think it's 26 people in every million people in the United States of a population of 330 million are being tested. I mean, South Korea was testing millions. Anybody who, showed signs was tested, basically. And that's another way of addressing this in a real way. Testing 26 per million is just useless. Anyway, that's all I'll say. So check out the WHO statistics. The Johns Hopkins University estimates that the US now has surpassed China. Their estimates are much greater. It's like 82,000 cases. That was yesterday. I'm sure that it's probably much more than that today. Today's 28th of March in Australia. So anyway, thanks so much for watching. My name's Trish Roberts. You're watching Faint Signals from Vega. Please stay safe, stay at home, only go out for absolutely essential things, and keep away from people. Wear masks, make your own masks if you can, and wash your hands all the time. Don't touch your face, and let's do everything to flatten this curve, and as soon as possible to reduce the number of people in the world who are going to die if we don't do that. It's an act of love to stay at home as much as possible, and let's do some inner reflection about our lives and the way our society is being run, and the capitalist insanity that there is, and also the it's evidence of a spiritual malaise, I feel, when we see older people or elderly people as irrelevant and disposable, or that we see poor people and homeless people as irrelevant and disposable, that we think that the economy and Wall Street and these corporate-owned politicians, that they get to run everything and tell us how we are going to live and how we're going to die. That's outrageous. How have we let that come to this? How have we let it come to this? So we're going to have to do some inner reflection on how we can turn that around, because this is not living if we're allowing a few small people, a few small percentage of people on the planet decide who lives, who dies, how we live, whether we are treated in a respectful manner, and so forth. Thanks for watching. Till next time. Bye for now.